from the Psyhub Podcast Network.
Hi, everyone. Welcome back to the Burnout Antidote, infusing well-being into healthcare culture. I'm Amy Pearlman, here with my colleague.
And I'm Paul Deger. Good to be with you, Amy.
And today we're going to talk about social unrest and the healthcare environment. Feels like another heady topic, Paul.
Yeah, necessary, but also one that I feel obliged to do right by it, and make sure that we really speak to the reality of the past few years. And you know me, I'm the word guy, word and data. I have hard stuff too, but I also have word and data stuff. And making sure we understand what are we talking about here with social unrest, and recognizing that this is one of those topics that we all come at it from different life paths, and there could be different degrees of discomfort and ways of dealing with that discomfort. And recognizing we're talking about big picture here, that this is not something subtle and small, but we're looking at the larger unfolding movements of the past few years that have taken many different variations, but with that common theme of, Amy, I'm going to date myself a little bit here. I'm thinking about the movie Network and that scene where I think he's an executive that yells out the window, it's something like, I'm sick of this and I'm not going to take it anymore. And then everyone starts to yell outside their windows. When I think about social unrest, it's like, this is yelling out the window type of stuff. Like, enough. It's time to change.
I really love that that kind of description, because it makes me think more of a reaction than of what is actually going on in the environment. So we think about the actual word unrest, and that's different than what we've been talking about all along through this series, with thinking about breathing and kind of being mindful and going through,
Good
or even
point.
just the way you usually speak, Paul, I think of as having maybe the opposite of unrest.
Mindfully yelling out the window.
Yes, mindfully yelling out the window. I like that. So being thoughtful and reactive in a different way.
Yeah.
Understanding that the nature of this is discomfort. And what does that feel like within the workplace, or what does that feel like within healthcare in general? Because we have a sense of what that feels like in our environment,
Right.
because it's prevalent. It's everywhere. And how do we react to that?
Yeah, this reminds me of this concept when I was in grad school about, so I went to a grad school that had Buddhist themes to it. And this idea of engaged Buddhism, that, sitting there calmly cross-legged on the mat, is the world needs more than that. So I like that idea of a call to action here about, thoughts and prayers are not enough. It's time we do something. So I think we've set a tone. What do you think?
I think this is valuable conversation for us to be having. And I'd really like to open the conversation and hear the story of one of our colleagues.
All right, let's do that.
When a global crisis such as the COVID-19 pandemic happens, it inherently places a spotlight on socioeconomic issues. In particular, COVID-19 highlighted the underlying issues regarding race discrimination, mental health, and immigration laws. From a medical and researcher perspective, tackling these issues as a single player is impossible. We make a vow to help prevent, cure, and alleviate disease and illness, but often ignore the barriers we as healthcare professionals face when it comes to treating patients equally. Even before we graduate medical school, the literature available for minorities is very scarce. The scales and algorithms we use for various diseases are biased to the white population, and the cultural aspect of healthcare is rarely studied and valued. The pandemic exacerbated healthcare disparities, particularly in relation to access to healthcare services and the impact on marginalized communities. Black and Latino communities have been disproportionately affected due to the systemic racism and discrimination, limited access to healthcare services, and higher rates of underlying health conditions. Healthcare providers must work towards providing culturally sensitive and equitable care to all patients inside the hospital setting, but in my opinion, this needs to go beyond the white walls. Doctors usually don't like to get involved in politics and feel more comfortable limiting our role to strictly a clinician role. However, these issues are systemic and require us to address the root causes of healthcare disparities such as racism and poverty, and advocating for policies that improve access to quality healthcare services for marginalized communities. For example, undocumented immigrants or Blacks might avoid seeking healthcare services due to fear of deportation or mistreatment. This can lead to delayed diagnosis and treatment of medical conditions, resulting in more severe health problems for the individuals and overall higher healthcare costs. Some ways we can address this is by promoting research on racial and social disparities in healthcare. Over the last 3 years, research on these topics has increased significantly, and this has been extremely important in policymakers recognizing them as urgent public matters. One major shift has been the increased focus on the impact of social determinants of health, such as poverty, housing, and education on health outcomes. With this data, systemic changes such as increasing efforts and government investment in affordable housing can happen. With regards to immigration, the California Collaborative for Immigrant Justice, alongside other nonprofits, have worked effortlessly to shut down several detention facilities, which was not only a mental and emotional threat for folks inside detention, but also posed a serious medical threat, as no COVID-19 precautions were being taken. In my area of work, which is skin cancer and particularly melanoma, there is a common misconception that melanoma does not occur in people of color. However, it does occur, and when it does, the mortality is disproportionately high. This has been stipulated to be a consequence of socioeconomic factors hindering access to care, as well as the underlying belief that dark skin confers a total protection against sun damage. However, more studies are needed to identify exactly what are the drivers in this high mortality in the population. All these issues, when facing them as a single caregiver, is overwhelming. As a Latina, I feel a moral obligation to create a positive impact in my community and help us and other minorities thrive. When I am unable to do this because of organizational or federal laws, this generates a deep feeling of frustration and anger, and in general, powerlessness. However, there is power to our voice and power in the medical community to push for change and help bring equity in healthcare.
That was a powerful story.
Yeah.
And I felt like I could resonate into this as something bigger than just one part of our identities, and really the several components that come into who we are, both personally and in the workplace.
I found that phrase "beyond the white walls" not only poetic, but I mean, so many layers within that statement, and this idea of, I think sometimes when we walk into our healthcare facilities, we do want to leave the world behind of, the chatterboxes on social media and, politics and all that. And the reality is it impacts there too. So we really can't, to shut that door, I think is kind of like denial in a way, and just pretend we're just here to do healthcare.
I agree. And I think that kind of denial feels like this old school sense of what the workplace used to be.
Good point. Yeah.
And I think about it as I'm going to take off my mom hat and put on my worker hat
right.
and then go to work. And that's not what we talk about in today's workplace, and certainly not what we talk about in healthcare, where so much of the work is about humanity.
Yeah. Well, and recognizing that with the pandemic, I think it sort of ripped the lid off. Changing hats. I'm mixing metaphors now, but you can't. It's there. It's inside. It's inside the walls. It's outside the walls, and it's impacting outcomes. It's the work we're there to do. It's quite evident that it's having an impact.
I started to think about that in terms of both strengths and risks.
Yeah.
The outcomes that come with increased risks that are tied to access to healthy food, fruits and vegetables, education, housing, environmental concerns, and how that affects so much of our health,
right,
and also so much of our well-being, and this idea of safety.
It almost reminds me in the world of cardiology that Dr. Dean Ornish, I remember, was laughed at when he first started talking about meditation and lifestyle can reverse heart disease. And I don't know if it was back in the 60s, in the sense of, well, no, that's silly talk. And now it just recognition that, how we lead our lives impacts our health. And maybe the next version of that is this bigger social determinants of health. And that social unrest, I'm going to be optimistic here. We talked a lot about this in Coming Back Better. Disruption creates opportunity. Now I can't deny anymore. And so now it's time to see, what can I step up and do? And I appreciate she said, as a single player, there's some barriers, but it's more of, what can I do? What one influence I can have.
I loved that. And I also loved the way she used the word proud. So she's starting out saying, I am a proud woman.
Yeah.
That owning these parts of our identity and a sense of belonging is something that we see as a protective factor, so that there are some strengths with having this shared purpose, this shared voice, and all the shared understanding that this is not okay, and we are going to fight to make this better for ourselves and for the community.
Well, I want to call upon a mindfulness quality here. And as far as curiosity, because when she talked about that, there's so many assumptions based upon our algorithms and our narrow research subjects, that idea like people of color don't get melanoma, and invite our listeners, because sometimes, the fight gives us the energy to do something, but it may also be further exhausting. But curiosity, I find, fuels me. And so to start asking questions about, what do we know and not know at this point around the influence of all these factors driving social unrest.
That's powerful. And it also gives a sense of freedom as we walk into this questioning or this opposition to some extent. I think there can be a shared purpose in reclaiming justice. I have thought about this, and Paul, you've heard me talk about this several times too. In our work, we like to talk a lot about evidence-based practice.
Right. Yeah.
Because we all want, as healthcare clinicians, we want to do what we know works. But questioning what we know works with a middle-aged white male, maybe even middle class in that component, may not be what works with the whole population. So an understanding of what evidence, what research, still taking what's valuable out of that evidence, but having a questioning or a curious way of learning or responding has been so helpful to me.
Well, yeah, I mean, a treatment may not be working. And if we're not asking the right questions about why it's not working, taking into account these bigger systemic racial questions, we're not going to get to the answer that we want to provide good care. So I think that there's something here around leading with that curiosity piece.
Us healthcare clinicians are driven to heal and help others. At Psyhub, we offer a wide variety of content that can support your well-being, help you find new creative and evidence-based ways to practice, and get inspired again. Whether you want to better understand depression, or you're interested in providing trauma-informed care, or you want to learn about navigating grief, our vast library of educational content has you covered. Psyhub offers curated continuing education learning opportunities on a variety of timely and relevant mental health topics and evidence-based interventions, geared specifically toward healthcare and mental health providers. These custom learning programs will empower you to support better mental health for patients, colleagues, and yourself. Learn more about our evidence-based mental health education opportunities at psychub.com.
The other point that popped in my head is also, as an advantaged white middle-aged, I don't know if I'm still qualified as middle-aged at this point, male, also making it safe for there to be anger and reaction from people that have been harmed along the way, and making a safe space for that, being a safe person for someone who has been harmed unjustly to be able to express that, whether it's a patient or a colleague.
I agree. And looking at anger, especially as an emotion that feels pretty uncomfortable to several of
Yeah.
us, knowing that presents differently in different people.
Mm-hmm.
And if someone is not ready to exhibit that anger, or that's just not the way they roll,
Yeah.
I like this larger understanding
Mm-hmm.
so that we see what's going on in context and in terms of power dynamics and privilege as
Yeah.
well.
Well, and the other side of that is then standing up to intolerance. It goes on, whether it's, in rounds or at the nurse's station or, in the clinic, and being willing as a privileged individual to point that to, one, model compassion and kindness, and two, to stand up to injustice and intolerance where and when we see it. That is something one person can do.
And it's an understanding of different layers of power and privilege where we all fit into the marginalized role
Yeah.
at some point, and it's something that we all see.
Mm-hmm.
I think any of us would be hard pressed to not give an example of this out in the world, but understanding those dynamics. We spoke about this a little last time with knowing yourself, knowing how your identity really affects how you see the world,
Yeah.
and continuing on the journey in that way.
Well, and Amy, I know that you've been quite the advocate for DEI work within organizations, and I'm getting a sense that you could offer us something here to practice this week around this topic.
I will do my best,
Oh,
Paul.
sorry to put you on the
What
spot, but I have confidence in you,
no.
Amy.
I think there are some spaces here with really knowing what it is are our triggers.
Okay.
So this is not a one size fits all tool for your toolbox.
Okay.
Thinking about this not as an individual, but as a societal issue or a systemic issue
Mm-hmm.
is really the way to start, even though it affects all of us as individuals as well.
Okay.
Taking some ownership in terms of our roles to heal together,
Mm-hmm.
not in denying anything that has happened in the past or continues to happen.
Okay.
Having the questioning nature that you mentioned, thinking about access to media,
Mm-hmm.
how much we watch of what is going on in the world. I think about this as talked a bit about screen time and tend to monitor that quite a
Not
bit
just for
with
kids, but us too.
younger people. Right.
Yeah.
There's our new tagline, screen time, not just for kids. Or maybe I should even say monitoring
Yeah. Screen time limitations, not just for kids.
Agreed. And the biggest takeaway that I will say, this one feels like it is more of a one size fits all, is to not be afraid of talking about this, even if we say the wrong thing.
Yeah.
And in turn, with talking, being ready to listen.
Mm-hmm.
So listening, talking, and working through it as a community, I do see a sense of community as a huge protective factor.
Mm-hmm.
And when we do not talk about this, we start erring into this isolation,
Yeah.
which I think grows social unrest, also grows a sense of powerless or feeling stuck.
Mm-hmm.
And those components really sound a lot to me like what we've been talking about with moral distress, injury, and burnout.
And if I think back to, self-compassion is our broader solution for moral distress, or antidote, I like that word better. And the common humanity feels like that's the element we're speaking to here, of a inclusive community is part of common humanity. Because sometimes common almost whitewash, the word can whitewash, I think, community. And so we want to have a inclusive common humanity, if I may say so.
Inclusive means a lot to me, I think, in terms of that DEI work, but also in terms of a goal we strive towards where less people are in isolation and more people are included in both the common suffering, but also in the antidote.
All right. There you go. I think we've done our work here today, Amy.
We have at least put the word out there, and I hope it's a conversation we continue to have.
I agree. If we've done our work, then more conversations will come out of ours. So to our listeners, I encourage you to talk and listen. Thanks.
If you'd like to reach us, you can do so at podcast@psychub.com. To be notified of new episodes, don't forget to like, subscribe, or follow wherever you're listening. And reviews are so helpful, so please do leave one if you can. It allows others to find us and to join along. The Burnout Antidote is executive produced and edited by Jacob Morrison. Research is assisted by Tekla Ross. Show artwork was created by Ornella Jangoli and Ashton Smith. A very special thanks to Juliana Castro, Alyssa Fackler, Trevin Stiegel, Andrea Womack, and of course, our pet, Pickles. The Burnout Antidote is a co-production from Psyhub and is brought to you by Janssen Neuroscience.